Hi, I'm Dr. Cody Van Dyke, and I'm one of the optometrists here at Village Optical. This video is intended for our patients who are learning to insert and remove ortho-keratology lenses, also known as Ortho-k. This video is not a replacement for an in-office training with one of our great team members, and if you want to learn more about what Ortho-k is, or whether or not you would be a candidate for it, we have another video for that too. Let's get started.
First, wash your hands with soap and water, and then dry them with a lint-free cloth. Make sure you have a clean area to work in, and if you're near a sink, make sure the plug is in. Your Ortho-k lenses should be stored in a hydrogen peroxide cleaning case. Remember that as long as the reaction is done, the lens is safe to insert directly onto the eye. Place the lens on your index finger, like a bowl. For comfort, we recommend inserting a drop of preservative-free artificial tears onto the lens. Use the middle finger of that hand to get your lower lid, and use your other hand to hold your top lid. Remember that the most common trouble for new contact lens wearers is not holding their lids wide enough, or accidentally letting them go and blinking. Don't be afraid to hold your lids firmly, especially when you're just starting out. Ortho-k lenses need to be placed directly onto the cornea, which is the clear part of the front of the eye. They cannot be put on the white of the eye and then repositioned. Using a mirror, line up the lens and place it on your eye. Gently let go of your lids and blink. That's it. You will be able to feel the lens, especially if you're new, but that sensation does fade with time. Your vision should be clear with the lens in, which is a great way to check that you've inserted the lens properly. If it takes a few tries, rinse off any debris or eyelashes that may have stuck to the lens, and insert a new drop of artificial tears. If your lids have gotten wet and slippery, dry them off and restart. It can take some practice, but you'll get it. If you're inserting a lens for someone else, the instructions are the same. Just make sure that the lens goes directly onto the cornea and that your hands are clean before you begin. To remove the lens, wash and dry your hands. Use a small plunger and stick it to the bottom or top of the lens, and pull to remove. You will want to pull at a bit of an angle, almost like you're pivoting the lens off the eye. Do not place the plunger in the center, as this won't break the suction and you may be pulling the whole eyeball along with the lens. Once the lenses are removed, insert it into the hydrogen peroxide cleaning case. Fill the case with peroxide and allow for at least 6 hours for the reaction to complete. For more information, check out our video on cleaning and storing contact lenses.